Okay, so we mentioned that the costal facets on the thoracic vertebrae are the points of articulation between the ribs and the vertebrae. This relationship is very simple in some ribs. Ribs 1, 10, 11, and 12 attach to just one vertebrae. So looking at how that happens here on this image. So up here, this is the front of the body, that is anterior. We see our vertebrae here, and there's the spinous process. So this is posterior. So if we look at this rib, so this is the anterior part of the rib, and it's going to curl around, and out here you're on the side of your body, and then we're at the back here, and you can see that a piece of the rib attaches right there on the transverse process of the thoracic vertebrae. The point of attachment between the rib and the transverse process of the thoracic vertebrae is known as the transverse costal facets. But it doesn't stop there, right? You can see that that rib continues to curl. It curls anteriorly, so now it's reaching forward to attach to the corpus. And you can see that here that it's going to attach to the superior costal facet of that same vertebrae. So ribs 1, 10, 11, and 12 have 2 points of attachment to just one vertebrae. Each has 2 points of attachment to just one vertebrae. A one-on-one relationship. But the rest of the ribs aren't that simple. Ribs 2 through 9, they'll curl in and they'll attach to the transverse process at the transverse costal facet, and then the head of the rib will keep curling in and it'll attach to the superior costal facet, but it will also, a little bit of the head of the rib will also reach up and articulate with the inferior costal facet of the thoracic vertebrae above it. So looking at this rib, you can see that it has 3 points of attachment. So ribs 2 through 9, they'll curl in, they'll attach to the transverse process of one thoracic vertebrae, keep curling in, attached to the superior costal facet of that same vertebrae, but they'll also reach up a little bit and articulate with the inferior costal facet of the thoracic vertebrae above. Moving now into the lumbar vertebrae. So compared to the thoracic and the cervical, the lumbar are fairly simple. They're just big, fat bones meant to hold a lot of weight. They're very utilitarian. They're larger than the thoracic, they're larger than the cervical. And when you have lower back pain, probably your parents are probably my age, and they're getting to the point where they're starting to have lower back pain. And that is because the cartilaginous discs in between the lumbar vertebrae are starting to break down. And when they break down, the vertebrae start getting closer to one another, and those nerves that are exiting from between those vertebrae through the intravertebral foramina are getting pinched. And that can cause a lot of pain. Cervical, thoracic, lumbar, sacral, coccyx. Your sacral vertebrae are fused together in a single structure known as the sacrum. This is the centermost, the medialmost portion of your pelvis. So your hip bones attach medially at the sacrum. So there's generally 4, 5 fused vertebrae within the sacrum. There are holes in the sacrum through which nerves enter and exit. These are known as the sacral foramina. And then moving more inferiorly to the coccyx. This also is usually 4 or 5, maybe 3, 4, or 5 fused vertebrae. This is a small structure at the bottom of the vertebral column. And we think about the coccyx more than anything when we think about breaking the coccyx. So this is when you break your tailbone. And it's a very painful situation. When I lived up north, we would build, and my kids were little, and it would snow a lot. I would build these basically sled chutes going down the hills from our house, and it would get very exciting. And occasionally, if an adult tried to do it, it'd be so rough sitting on the sled, they'd bruise their coccyx, and it'd be a very painful situation.